Now, our next presenter, Andrew, probably is thinking that he would like you to stay standing as he comes to the stage. Andrew is a cancer survivor. He has two young girls, Abigail and Megan, 5 and 3 years of age. He's also the honorary chair for the Road Hockey to Conquer Cancer event, and he is the ambassador for the Ride to Conquer Cancer. And he has a patient story for today about dealing with kidney cancer from an early stage patient point of view. Please welcome Andrew.
Thanks.
Thanks for coming.
Thanks. My mother once told me that I love the sound of my own voice, so here I am again. I guess she was right about it. I like the attention so much, actually, I don't have a fancy slideshow, so you guys can all look at me. I was first contacted about this event back in October by Dale Miron. She called me up one evening and explained Kidney Cancer Canada to me, and I didn't really hear much of what she said after she told me the event date. You see, 29s are fairly prevalent in my life, and let me just fill some of you in on that. There are a few people here that have heard me talk about them. So my oldest daughter, Abby, she was born on her mother's birthday, which was August 29. My second daughter, Megan, was born September 29. I was diagnosed with stage 2 kidney cancer December 29. I started my clinical trial 2 years ago today, March 29. I was accepted to another charity event, a cancer-related charity event on November 29. And of course there's today, which is another 29. Now there's two clinical trial coordinators sitting here, Laura and Asma. I was in to see them on Thursday, and they had an appointment for me for September 29, which I refused. Ladies, please move that by one day, which they did for me. And I told them it was actually for my daughter's birthday, but the truth is that I have a lot of mixed feelings about the 29. My journey as an early stage kidney cancer patient was very quick, to be honest. Before cancer, I was a fairly typical 36-year-old male, doing my thing. I described myself as large and in charge and living life to the fullest. I woke up one morning between the Christmas holidays, and I had a pretty serious problem. I went to the hospital, and I was released 8 days later, 30 pounds lighter, missing a right kidney, stapled up like Frankenstein, and I was cancer-free. One person called it a Cinderella story. I'm not sure there is such a thing when you're talking about cancer, but I will tell you a funny story about the hospital. The doctor, after he did the surgery, I had my right kidney removed, so I had this large incision on my right side, was talking to me about the pain and managing and how the nerve endings, Dr. Finelli touched on it earlier, and was saying how to manage the pain and how to, make movements that were a little bit easier. He didn't explain anything about the catheter removal, though, and that was way worse than the incision. My pathology, after I get out of the hospital, stated that I was a high risk for reoccurrence in the next 5 years. Realizing my own mortality had me shaken, and it was pretty dark for me for a few days, and actually that dark feeling still lingers a bit. During that appointment, I was informed of a clinical trial at the Princess Margaret with Dr. Knox. Apparently I was a perfect fit for it, and after much consideration and research, I decided to join. Although it was for selfish reasons, it was also to help others and raise awareness. 6 weeks after my release to the hospital, I was now admitted to the clinical trial, and I was back on the treadmill of life, going full tilt, back at being in charge again. I felt pretty normal and was living a normal life with new goals, new hopes, and a new purpose, if you will. Well, at one of my appointments, I noticed a brochure about Road Hockey to Conquer Cancer. Could this be another way I thought to give back and to help out? So I signed up right away. 2012 event, another new purpose, here we come. I became so involved with the Princess Margaret Foundation that I was asked to be an honorary chair for the event, which was a real honor for me, to be involved with people like Dr. Finelli. The 2013 event that just passed, of 1,313 participants, I was the 5th highest individual fundraiser, and I raised $34,128 on my own. My team to date has raised over $58,000 for research, which has gone to the Princess Margaret, and we consider that to be a great achievement. I have my name on a plaque, and our team name is on a plaque inside the Princess Margaret for the road hockey. So that's one thing I'm very, very proud of, to give back and help out. Last June, I did the Ride to Conquer Cancer, 200 kilometers on a bicycle on a seat about that big. I did the ride for a colleague of mine who was battling. He was battling cancer and was forced out of the ride, so I did it for him. This time I'll be riding this June with that colleague because of the Princess Margaret. This September, I'll be a participant in the Sears National Kids Cancer Ride. In September, I will ride my bicycle for 17 days, approximately 3,000 kilometers, stopping at various kids' cancer centers across Canada. We leave September 4th in BC, and we arrive in Halifax September 21. And again, that's on a seat about that big. And that is about kids' cancer and kids' research. And if you've ever met any kids that have had cancer, it's one area I avoid in the Princess Margaret when I go. These are all very fulfilling events. They make me feel whole and they make me feel complete. Now let me ask you a question. By a show of hands, how many people in here would say I've managed through my cancer diagnosis and treatment so far fairly well? What would you say if I told you were all wrong? Dead wrong. There isn't a day goes by that I don't think about cancer. Every ache and pain in the body, you wonder. It haunts my thoughts, and it took charge of my life. I thought there wasn't anyone who understood, and that there was a mental war that I was struggling with on my own. The theme of this conference is taking charge, managing your own health and well-being. I believe that does not end with your physical health, but only starts there. I had a friend explain it to me like this. He said, if you hurt your knee, you go see the specialist. He said, if you're struggling mentally, he said, you try to deal with it on your own. A psychologist isn't there to judge, but someone to add tools for you to use. And what a great advice from a person I respect a lot. I made the mistake of lying to myself by doing that, and the clinical trial and all the charity work I did would help me fix the mental side of cancer. Now get ready for this. I was wrong. I was really wrong. That was tough to say, actually, that I was wrong, but I got through it. Let me explain my experience. The thought every day of cancer coming back or still being there was enough to wear me down and break me mentally. So a guy who was large and in charge was just cut down in size. I got to the point where I was only on the treadmill of life and other tasks weren't important. I kept a good front up in front of everybody, and by front I mean lie. When people were around, I was fine. When the doctors asked how I was fine. When I was alone, driving, watching TV, I could cry at the drop of a hat at an instant, and to think that I was cancer-free and it still had a hold on me like this. The day I realized I was losing the mental fight, I remembered someone's words who still ring in my mind. I had just finished at the Road Hockey to Conquer Cancer event. I gave a very similar speech and told my story to 2,500 people. A man I'd never met before started to talk to me about cancer. He asked, do you ever wonder what every ache and pain is? Does it haunt your thoughts? Do you think that nobody understands? All of which I agreed to. Until that point, he was the only person that seemed to know what I was thinking or feeling. He shook my hand, wished me well, and said if I ever needed anything to get in touch with him. I thought that would be a call I would never have to make. The emotional, mental aspect should be easy. I was cancer-free, so I thought. I would have to say that by reaching out to Dr. Finelli, it seemed as though he was the only person that could help and understood what I was going through. He said all the right things. I have since learned that there are many people with his understanding, many people to help us. I had just taken the first steps of the process of well-being. I was admitting I couldn't do it on my own. Having the courage to admit needing help is not a weakness but a strength. After a few sessions with a psychologist at Princess Margaret, Dr. Matthew, I had a whole new set of tools to work with, and I felt great. I have a new understanding of mortality, and I understand that well-being is the best way to extend the mortality and the quality of life. Not being afraid to talk about my cancer or the help that I needed has helped me more than I can say. My goal is to raise awareness of treatment and support, both mental and physical. I've learned a great deal about myself in this journey, and it came at a price, the price of having to swallow my pride, and as a guy, it's hard to do. Every survivor in this room has had some of the thoughts that I've mentioned. All the supporters have wondered why their loved ones seem distant at times, but just know that they're not being distanced, they're struggling. I believe personally that the key to success is awareness, both mental and physical, in this journey. There is more to cancer than medication, surgery, and chemotherapy. Being aware and seeking help is the beginning, wellness, and leads to better health. I have a new understanding of this battle, and I have Dr. Finelli and Dr. Matthew to thank for that. And I realized cancer was not my choice, but my attitude is my choice. Oddly enough, I never met Wally before, and actually I still haven't met him, but I saw him on Thursday, and I'm happy to say that Dr. Knox also informed me on Thursday that I was 2 years cancer-free. And taking charge is the message I want to leave you with. I'm doing that, and it's making a huge difference in my life. Thank you.
Thank you, Andrew. It's a lot of, I talked about patient themes coming up again and again that happened. How many, just by a show of applause, how many people in the room did Andrew's thoughts touch?